An emergency is sudden and can be frightening for the caregiver. But being prepared will make a difference in how you respond and will result in a better outcome for the older adult. What should you do when a resident has an emergency? Follow these 4 steps. Assess the resident. A caregiver should be able to give 911 an accurate description of the problem, so a quick assessment of the resident or client should be completed first. It is important to describe what has happened and what you see. It is not important to make a diagnosis, but to decide if a resident is having a medical emergency. Here are some questions that might be helpful in determining a medical emergency. Is the resident awake and responsive, or confused, hard to arouse, or unconscious? Having difficulty breathing, choking, wheezing, or not breathing? Are new hives present, or the resident's lips purplish in color? Is the resident complaining of chest pain or pressure? Complaining of a severe headache? Unable to move arms and legs equally? Have slurred speech? Or have difficulty speaking or walking? Did the resident strike their head or have a fall? Complaining of terrible pain in a certain part of their body? Unable to move a part of their body or have a broken bone? Is there a lot of bleeding or bleeding that won't stop? Has the resident's appearance changed, such as pupils enlarged or not the same size? Or is the skin cold, clammy, pale, red, hot, flushed? Call 911. When a resident has a sudden change in condition that may be life-threatening, call 911 immediately. Calmly describe the situation you have observed and any complaints that the resident has told you about. If you know about a resident's regular illnesses such as diabetes, COPD, or heart disease, give the 911 operator that information. Do not try to take the resident to the hospital yourself. Always call 911 and follow the instructions from the 911 operator. Administer first aid if appropriate. Stay with the resident, keep him or her in a comfortable position, and encourage him to stay awake and talk until emergency responders arrive. Do not move the resident if he or she has fallen and is complaining of severe pain. If it is appropriate, provide first aid that is within your training. Notify all responsible parties. Relate the details of the situation as you know them and as the resident reported them to you, what actions were taken, and the current location of the resident. Do not report what you do not directly know.